Let's see. Again, another show with Crooked Spine Show. I'm Dr. Tony. This is Layne VanLieshout. She LV for short. LV
Wellness.
Wellness for short.
Yep.
We're here to talk about when your doctor tells you everything is normal, but you still feel something's going on. It's not your normal self. How do we understand what that feeling is? Because you know your body, people. Okay, you've had it longer than most doctors that see you have had it. So I want to understand is as a functional medicine clinician, ladies that allow people to understand why they feel unwell. Okay, in that sense of we talk about our topics. There will be hormone imbalances. Why does it cause fatigue? Why does it cause sleepiness? Why does it cause brain fog? Also gut conditions. How does it cause bloating, gas pains, things like that for one too. Also talk about too is everything is normal, but why? And again, our main topic for one too. And how is stress impacted or affected by cortisol, hormones, and also metabolism, and overall short-term, long-term stress and how that affects your overall body. Last topic will be navigating through your hormone imbalances and how it affects your overall guts and links back to that. So start at the top for one too. LB, how do we understand where your background is? Go ahead and do that first.
Yeah, so I'm a nurse practitioner. I've worked as an NP for over 33 years. And I've been in the hospital medicine world, so acute care, very sick patients. I have additional background in the medical field as a whole for about 13 years. So I've worked with a lot of people who are, really struggling with their health. And over the past several years, I really started diving into functional medicine. It led me there because of my own health struggles and just kind of realizing, some of the areas that our traditional medical system falls short in. And so started my formal training in that as well. And now I work with clients to help them get to the root cause of their symptoms or their disease processes, because that's really what functional medicine is all about is, root cause medicine. And so getting to the root cause is really how we heal. It's understanding what led to the condition and the situation that you're in now. And so I work with my clients in a stepwise approach to address the imbalances that we discover that are contributing to their issues, with a goal to either reverse certain dynamics or prevent disease progression or disease development in the first place.
And when you do that, how do you start them out? Do you do an assessment through blood work, through imaging, through a consultation? How do you usually start that?
Yes. So it starts with an initial consult. So I spend about 90 minutes on that initial consult. We go through their health history. So a pretty detailed health history, a collection of data, what they've been through, what their current struggles are, what their past struggles are, what medications are they on, what medications did they used to be on. It goes back really, really far. What traumas have they had? It's really like a holistic approach in that. And that's really what starts the puzzle piecing on my part. So like, how are things connected and what led to what? And, what was maybe the inciting or triggering event? And that gives us that clarity, that broad picture overview. And that's what guides us, moving forward. So once we have that information, we know what labs are going to give us the best information or tell us the most. What labs should we pursue because of that? And then looking at the labs, we'll create a custom protocol depending on what we find and the symptoms that they're struggling with. And also, you have to take into account people's preferences. There's not a one size fits all program. And that's, one of my philosophies is everybody is very unique. And so every protocol will be a little bit different. Although there may be some trends in certain things, you've got to take the whole person into consideration for sure.
Well, you're spending 90 minutes was 90 minutes, not 15 like you would with a general practitioner. You're able to understand someone's overall, not only their health, their family history, their, like you said, their preferences too, what they like to do and what they've gone through, understand their whole life history.
Yes. So it's extremely different than a 15-minute approach or consult. That is such a short window of time. Like, how can you understand what this person's been through? And I've always loved the hospital. So that's where most of my background is. It's not in the office setting. So I'd never had like the 15-minute time limit, but I still have very busy days where my time is, there's not a number limit on it, but it's still limited if I want to get my work done. And so is still quite a factor. And, unfortunately, insurance is what drives that. How many encounters can you have per day? And that's how insurance drives the show pretty much.
It's almost like when you talk about medicine in general, they're there for emergency cases, figure out what's going on, say if you want to have a problem today. You're there to help them understand, okay, the problem that you have is still there. Let's figure out the bigger picture of how to make that problem go away, that root cause. Let's find the root cause of the problem by spending the time with someone, understanding what their time frame to actually heal would be. When you talk about hormone imbalances and things like that, how do you usually diagnose that? How's that diagnosed?
So you use symptoms. They're very telling. So the symptoms guide the test. And one of the major hormone tests, I mean, first of all, full thyroid panel is very important. So not just a TSH. You want the
And what
TSH.
for my lay people patients, what's the thyroid for, and what is the TSS for? TSA for?
TSH. So the TSH is a brain hormone that's, produced by the brain that tells your thyroid to produce more or less hormone. And so it's like it's a negative feedback cycle. So if there's more TSH, and it's going to produce more thyroid hormone. Now I'm getting confused. Talking through it is so complex.
Well,
But
a lot of it, when I talk to patients about it, your body's meant to self-regulate. When it's under stress, it'll produce hormones that make your overall body more stressed, and almost feed itself for sometimes to over chronic condition. You've had it more than, say, for example, a couple of months. Now your body's made your body change your hormone levels, so your thyroid's able to self-regulate at a certain point, but over time it gets fatigued, exhausted. Then that's why they sometimes medically they're going to want to take hormone therapy, or now adjust it artificially versus fixing the root cause of what's causing stressor to that thyroid.
yes, and that's one thing I like to bring up too is our bodies can compensate. They are so smart. They can withstand a lot of different things, a lot of stress, and especially short-term stress. So that's kind of where the acute versus chronic stress comes in. An acute stress response is for survival purposes. We need that. We need that ability, but we have a lot of chronic stress in our daily modern world, and that's pandemic related, just other modern world stuff related. It's not pretty much affects everybody. And so when we get in that chronic stress state with those chronically elevated stress hormones that then impacts other hormones, it's all like a revolving door. And so it does get to a point where your body can't compensate and cover up the imbalances anymore. And they start showing up as symptoms.
So it's almost whatever stress level someone can handle normally, it gets above that level, and their body's hormones will become off, or if you want to call it imbalance, to now maintain that higher level to handle that better stress. Even though it's not handling it, it's dealing with it versus actually doing it in a healthy way.
Yes. So it is compensating. It's doing what it has to do to continue functioning, but it does have consequences at the end of the day, and it will start showing up, and you will start feeling it symptom wise if it goes on for too long uncorrected.
What's the symptom someone has when they have it more chronic condition like that becomes more chronic?
Like with stress in general?
Or with hormone imbalances in general?
Yeah. So, any chronic stress, again, can lead to any hormone imbalance. It particularly affects your cortisol. So when your cortisol, it initially may be high. That's, again, the compensatory survival mechanism. But over time, your body is going to reduce that cortisol level for survival long term. And symptoms of low cortisol might be dizziness with standing or extreme fatigue, even during the day, no matter how much you've slept. Or sometimes your cortisol cycles are off. So they'll peak at night and be low in the day when it should be the opposite. And so a lot of people might have insomnia. They may have issues with their weight, whether it's weight loss or weight gain sometimes, low libido, and hair can be affected, skin can be affected, just to name a few. But then that can go on to further affect your thyroid, which is then when you might see, more weight gain, dry, brittle hair, coarse hair, trouble losing weight, constipation's really common as well, cold extremities, just to kind of name some of the big ones.
And when someone gets put on, for example, hormone balancing therapies and medications, how does that, if you want to call it, affect them short-term, long-term? Does that actually help the problem, or is it something to where it's more of a Band-Aid?
It's more of a Band-Aid for sure. And it kind of depends on what triggered the thyroid imbalance, and which likely can often be traced back to stress, nutrient depletion, or like toxins even can affect the thyroid. Like fluoride, for example, can mimic iodine, which has an impact on the thyroid. So your question was what again?
Well, that's what it comes down to, is really what it makes your overall body become more stressed on that, for one, too. A lot of it is what you're saying, too. A lot of it is our body will start to adjust in a negative way until we find the root cause. And the medications that sometimes doctors are giving us will almost make our body self-regulate to make the problem even worse sometimes.
Yes. So that's what I was eventually going to say, that I forgot completely where I was going. But so the thyroid hormone, exogenous thyroid hormone, can be helpful in short-term situations. it also depends, like, are you getting T3 or T4 or both? And so that the T4 is the T4 is the active hormone. And so, or the T3 is the active hormone. So it really depends on what medication you're getting, and then is your body converting that to the active form. And so it's really dependent on each person's biology and how they process things and what they need specifically. And people can come off of thyroid medicine if you start to correct the imbalances that led to it in the first place.
Well, the problem is you may go to your medical doctor or your general practitioner and go like, hey, how do I get off my hormonal therapy? They're like, I don't know. I put you on there. It's not my job to take you off. No.
Yeah.
So a lot of it is you're going to someone like Layne, who's a specialist in this, to help you understand, okay, I've been for a long time. I'm not seeing results. I want guys to, now I've read the long-term side effects of being on hormone medication, such as cancer. At that point, how do I not give this up? Talking to someone like Layne allows you to actually understand there's a different way to do this so your body can get healthy without the medications.
And so medications can be very useful in short-term situations, like with thyroid imbalance, because that can help you feel a lot better. But what you always want, the goal is to keep digging deeper and deeper so that you don't require medications if possible long-term.
And also to going from medications and affecting how it affects overall body, how is gut health affected with overall health?
So gut health is directly linked to overall health. And it comes down to, with gut health in general, we're talking, how's your stomach acid? How's your digestion and absorption and bringing the nutrients on board from your food? How are you putting those nutrients into yourself, or the processes like energy and hormone conversion and all those things for detoxification even? And then we also think about microbial balance. So your natural gut flora, how is the balance there? Because that can get thrown off from stress, from medications, especially antibiotics, but a lot of other medications can affect it too, because they act as inflammation. Toxins themselves can have an effect on the gut lining as well. So we really, also with food sensitivities, and you get concerned when you start having, like, leaky gut, for example, is a growing condition that we're recognizing more and more. And what happens with that is your gut barrier, it should be intact and semi-permeable, so things can go out of it as the body desires, but only certain things. And then when those cells get more gaps in between them, and the integrity of that barrier is broken, that's when byproducts of food and the microbial byproducts, they can cross over into the systemic body. They can target tissues like your joints or your skin, your thyroid, even your brain. And that's when a lot of symptoms show up, like joint pain or arthritis, even autoimmune conditions like autoimmune thyroid, rheumatoid arthritis. And it can affect your mental health a lot as well. It can create what we call leaky brain. That's not a technical term, but because it also crosses the blood-brain barrier, some of those byproducts, it can cause that lack in energy, the decreased concentration, mental health imbalances like anxiety and depression too.
It almost makes your body, your intestinal lining, your stomach lining, even going back to going higher up, when your lining gets worn out, where it can't move, where it can't allow things to not come in, it's almost a filter. You lose that filter. Now when you're eating, even though it can be broken down, some of those byproducts become more like an infection in your body. It can show up like arthritis, brain fog, rheumatoid arthritis for one, two, intestinal, other issues in your body that they may seem more medical, but again, it's because your lining isn't working properly. Do medications, a lot of medications, certain ones, even hormone therapy, destroy the lining, or how's the lining, if you want to call it, broken down where it becomes a non-filter?
So certain medications that contribute to that are SSRIs, so like common antidepressants, and those have an impact on your microbial flora as well. NSAIDs are a big one too. And while we're on this topic, I actually made a resource for the listeners that kind of goes into a little bit more of things to avoid for your gut health, and NSAIDs is on there. Just because it does cause inflammation, it can lead to gastritis, which is more of a worst case scenario, and ulcers. But it can have smaller impacts as well that still have like a lot of effects, just in different ways. Low vitamin D, for example, is another. Having a low in that nutrient can contribute to leaky gut and the breakdown of that barrier. We see issues with
How about, like, for example, treatments for the COVID, or for COVID treatments for one, too, the last, say, few months or even a couple of years? Has that medication people have been on for that allowed the gut become more leaky, allowed the body to kind of break itself down faster?
That's interesting. I'm not sure really. I have not heard anything necessarily, but also have not really had to look into that, thankfully. But I'm sure any COVID in general, having any illness or infection, that is a physiological stress. So that itself, without medications, can certainly contribute to gut issues as well and causing that barrier to break down.
And a lot of it is when people just don't feel well, they've been sick for a while here and there. Now they need to, almost like you had mentioned, get something to now build that gut up. How do you one thing test the gut? Then from there, how do you now build it back up? What do you do to get that filter working again?
Yeah, so especially if people are having a lot of gut symptoms or you suspect some autoimmunity, because autoimmunity can pretty much always be traced back to the gut as a factor. Not saying it's the only factor, but it is a factor. And I often do stool tests, so a comprehensive stool analysis that'll tell us what's overgrown, what's undergrown. So like what is our balance and where are our good and bad bacteria? How's our inflammatory process in the gut? Are we inflamed? Are we clearly reacting to something? It doesn't necessarily tell us what it is, although one marker does tell us about gluten specifically. And so might need to remove gluten or other foods that are molecularly similar to gluten, like other grains or corn, even if it's just temporarily, so that we can promote that healing process and reduce that inflammation. So you want to remove any sensitivities that you know of, any toxins, rebalance, the microbiome and get, the good and bad bacteria kind of back to where they were meant to be, and address any overgrowths if you have to. And there are some supplements that are like, they are antimicrobial, like herbs and stuff. So I don't prescribe medications in my functional medicine role. I think that there's a lot of good supplements that we can kind of use in place of some of these things, and lifestyle factors, of course. And then there's other medication or other supplements that help repair and coat that stomach and intestinal lining again, that helps build that mucus barrier back up. And then if we may need to do probiotics too, to kind of reinoculate some of the good strains.
I mean, a lot of it is you're giving someone a chance to heal their inside body. So what they feel as a symptom allows them to feel better, but knowing that they're fixing the inside, not just another Band-Aid.
Yes. And so, I never want someone to be on 20 supplements for life either. Like nobody wants that. And so supplements should also be short term. If possible, there are cases where you may need long-term supplementation, but just for example, if you have low stomach acid and you're therefore not absorbing your B12, we can supplement B12 all day, but that doesn't fix the problem. And so it's all about, well, let's address our stomach acid. Why is it low? Let's rebalance whatever we need to so that the stomach acid gets back to normal. Then therefore we can absorb our nutrients again.
It's almost our body knows how to self-regulate, but if we keep adding more B12, at that point it's like, well, I don't have to make any more. I'm good. I'm good for a while here.
Yeah.
That's not good. That's not, because the problem is once you do that, other parts of your body's system gets broken down and becomes more, has to change its physiology. Now you go, okay, now what else? How can compensate here and here and here? And also, I read before too, how does vitamin A help or hurt the stomach lining? Vitamin A supplementation.
I'm not familiar with that concept exactly, other than with it being a fat soluble vitamin. If you're low in other fat soluble vitamins like vitamin D, for example, which a lot of people are, especially in the winter, especially in certain states when you're not getting that sun exposure. And, vitamin D has these implications in immune health for sure, but it also acts as a pro-hormone and therefore affects your thyroid and other hormone balance. And so vitamin A and D and E and K are all fat soluble. So if you're low in one, you're likely low in another. So sometimes doing a combination supplement is a good idea, just because if you do vitamin D or D3, K2 by itself, you can actually kind of deplete some of the other fat soluble vitamins. But specifically with vitamin A alone, I'm not sure.
Well, a lot of it is too, like I mentioned too, when you have a complex of vitamins, minerals in your body, when it gets depleted, why not kind of get it all set up again so you're back here? Then you can self-regulate here with your foods, with your lifestyle. Once you're there, at that point, when someone gets to where they feel pretty good, they're like, okay, I'm on track now, and you've retested them for 1, 2, their stool, their blood, whatever it is. How do you now help them maintain that healthier state?
Well, sometimes you can even do like a supplement vacation and just see kind of what happens and slowly reintroduce the ones we think we need. You can even retest at that point and see where we are. But as much like food as medicine as possible is like always, what I would prefer. And, getting out in the sun, get the natural vitamin D that way. all of those things.
Well, and when you have that, okay, once I'm here, now LV Wellness has allowed me to get to my healthier state. Did you help them kind of maintain that over time, or go, you're good, get the heck out of here, I got someone else to see?
So I typically work with my clients for about 6 months, just because that's a pretty standard time for a lot of people anyway, to really get to the bottom of a lot of things and set them up for that longevity, that resiliency. And
Right.
so they may be good after that. They may just need, a checkup every now and then, in which case maybe we would like schedule once a year or have labs redrawn once a year. But there's certainly cases where they're going to need longer, close one-to-one contact with me and like coaching and seeing what we need to tweak. It really is, case by case basis, especially with autoimmunity. It might take longer than 6 months. Or if it's something that's a little bit, has not been going on for quite as long and they've seen great progress in that 6 months, they may feel like they have been, prepped and ready to handle it on their own because they've made the lifestyle changes already that they can continue to carry out.
Well, a lot of it is too, I think a lot, and as I've done more interviews too, is your body has, for example, once you see Layne and finally talk to her, you've gone through the medical, my aunt would call it rigmarole. At that point, you've gone through all the systems of, now you're like, okay, they did not help me. I've been here for 6 months, a year, putting a bunch of medications. Now my body's even worse. Now I feel worse. What the heck's going on? They come to you, they're broke. Their body's broken. So at that point, when your body's broken, it's learned to make that your normal. So now you have to change your default to healthier state. That takes at least 3 months, minimum. I'm going to say minimum 6 months when you're that broken inside to get your body to reset, recalibrate itself, get its immune system back to normal, where you can maintain that with easier lifestyle changes versus supplementations versus testing for one thing. You almost have to go down a valley to get back out of there.
Yeah, for sure. And that's where I think functional medicine is so wonderful because, yes, a lot of people have been to multiple specialists.
Mm-hmm.
I was in that situation too. And I'm not saying they're not helpful, but like what are they doing to reverse the process or dig deeper like we do in functional medicine? Like, yes, they may give some valuable information. Yes, they are brilliant people. But it's all about getting to the root and setting up for that long-term success. So hopefully you don't need a specialist in the future.
Yes. Well, what I tell my patients, you become your best doctor yourself. Now you understand, okay, if I have a question, I can call Layne, but if not, now I know where to find the resources. And now I know what normal feels like. When I'm off, I'll try this. Now I can do it naturally versus going to my doctor. Okay, doc, what kind of medication I get this time? Like you said, medication is great short term, and that's a great short term. But long term, is your body really working properly or not? That's the biggest thing.
Yeah. And, something you mentioned in the beginning was, you're told that you're fine and then everything's normal, like go on your way. And that is like one of the most frustrating things to me because I've been there. And every day at the hospital, I feel like I've been that provider too. Your labs are normal, go home. And back, it's like, oh gosh. Like the thing is like, just like you said, your body best. And I preach that to my clients too. Like you know your body better than I ever will, better than any other provider ever will. You are in your body every day, obviously. And so when something's not right, that's when these warning signs come up as symptoms. So maybe it's fatigue, bloating, the stomach discomfort, trouble thinking, or skin inflammation, bowel irregularities, whatever it may be. They're all signals from the body that's trying to communicate to you that something is off. And even if they're not showing up in labs quite yet, that doesn't mean that everything's normal. And so
when you're talking about, okay, when you check someone out of the hospital for one or a private office, no one asks, do you feel like I helped you? Because the problem is someone may go, yes, but not what I wanted, not an expectation. And sometimes we may not meet that. But when you give someone a short-term, hey, here's medication, take this for 3 days. If you don't feel good, come back again. You're like, another time. I had a patient go take her mom to the hospital with pneumonia, end up bringing lung cancer. But they had checked her out, and he was an ENT, and he said, and we're going to hold off on here. Let's do chest x-ray and a CT. So they're like, okay, whatever. They go, oh, we missed this. So they're hoping for the best, obviously. Obviously, medical care, we need medical care. We need hospital care. We need emergency care. But when it goes beyond that, how do you find someone like Layne to help you navigate your process of getting to a healthier state and maintain that over time?
Yeah, for sure. And, of course, we definitely need emergency care. We need acute care.
Yes.
We have to have stabilization for, life-saving measures, limb organ saving measures. But again, it all goes back to, well, what led to this? Injuries and accidents are different. But when it comes to internal illnesses, you've got to start addressing the root cause that sets you up to have that problem in the first place. And, just taking a look deeper and deeper and, tracing things back further and further until you can start that healing process and hopefully not have that issue long term.
Well, a lot of this too is, and again, spending and one to that, yes, but also committing yourself, the person, the patient, the client, hey, it's going to take 6 months. Hey, I'm going to have to tell Layne everything I've gone through in my last, say, 30, 40, 50 years that I've gone through to make sure he understands my health history to give me the right reason to take supplements, to do this proper test. So I get myself long-term healthier for the next 50 years, make sure I enjoy a better quality of life where I can maintain it on my own.
Yes, exactly. And that's where a lot of the functional lab work comes in, and doing the deep dive consult with the 90-minute time frame is having that information is powerful. It's not just, here's what we know, this is what we're going to do. It's, that for the rest of your life, you can take that information with you to any provider in the future and use that to advocate for yourself, especially if you feel like you're not being listened to or heard or taken seriously by other providers. You have that information to use, as a resource.
You're almost educating people to allow them to become, again, more of self-confident. They know their body better.
Yes.
What the body needs to stay naturally healthy versus rely on everything else that sometimes they get put on medication, they go down the rabbit hole and they can't get out of it.
Yeah. And, unfortunately, our modern world makes it really hard to be healthy. There's a lot of things that that are ingrained in us, over the years growing up, and just practices and traditions and just what we used to cook with, for example, the foods we grew up eating, and just things that have kind of carried over into adulthood. It's all about, seeing how we were set up. We weren't really set up for success. But if you kind of take it, lean into it as, I do have this power. I do hold this power, and I have control over what I choose to put in and on my body, and, what I get exposed to on a daily basis. I mean, we have a lot of control. We don't have all control by any means. There's tons of toxins that we're exposed to on a daily basis. We can't avoid it all, but we can control certain things.
Well, a lot of it is we can't live in a bubble, right? But can we make our body strong enough, immune system strong enough, gut strong enough, our hormones balanced enough to handle the stressors of our day, of our life, our environment, so we can maintain that state of health even when we're under stress? At that point, we can recover a lot faster also. I mean, I come out of my office every afternoon for lunch and after my afternoon shift, and there's McDonald's about 2 doors down. There's at least 6, 7 cars in that line every day. I go, you guys are killing yourselves every day. Most people, I think, they don't want to listen until they have a health condition. And then sometimes it'll go, well, the doctor said this, I'm going to go with this. And they go down that rabbit hole and become another victim of that long-term bad health. So, anything else I missed for your second podcast, my first show with you?
I don't know. I don't think so. I think we covered a lot of good stuff.
Good. What do you want people to understand from my audience to help them connect with you? What's your takeaway?
I would say you know your body best, and you can and should advocate for yourself. So if you know something's wrong, then something's off balance, even if you don't know what it is. There are people who will listen to you. And if you feel like your provider's not taking you seriously, or you're not being heard, or you really think you need more detailed care, then don't be afraid to look elsewhere. And that's where I think functional medicine, integrative medicine is, really wonderful. So listen to your body, listen to your symptoms, don't brush them under the rug, and just know that healing is possible. You can get past this. You can support your body through these problems.
Good. And I like that, because once you do the 9-minute consult with Layne, it's going to understand, okay, I need more help than I'm getting from my medical doctor because I have this problem that's not going away. All right. Good. Anything else?
I think that's it. But again, with that resource that I made, so if you go to my website, so it's lvwellnessconsulting.com, and then at the top toolbar on the right, you'll see a free gut health guide. So that goes over, a little bit about how important gut health is, and a few things that you should start paying attention to that maybe you should reduce or avoid in your life, and then some things that you can start adding in to support that healthy gut.
What I'll do is add it to the show notes after we finish our talk. At that point, we'll have that resource as a comment and also on your YouTube channel and everything else we got to do. All right.
Yes.
One last way for the camera because I got to do this every time I come in. Thank you for coming. And then I'll end the broadcast right now. We'll talk afterwards.
All right. Sounds good.